Here is your question. Right. So if you have read and understood, considering it surgical pathology station, kindly please tell me what do you understand by the term signet cell carcinoma?
Signet cell carcinoma is not rare type of the CA carcinoma, which is arrayed into the rare type of carcinoma,
Yes.
with a poorly cohesive also called a poorly cohesive carcinoma.
What are the different types of gastric carcinoma you are aware of? How would you classify gastric carcinoma?
According to the WHO classification, the tubular adenocarcinoma, papillary adenocarcinoma, mucinous adenocarcinoma, secondary cell carcinoma, also known as poorly cohesive carcinoma, and mixed carcinoma.
Okay. Is there any other classification by which you can classify
There
them?
are another classification, Laurent classification, which differentiated into the diffuse intestinal types or diffuse type. Another one
Yes.
is the Bowman classification, depending on the microscopic feature of the gastric
Yes.
cancer,
Yes.
included the polypoid group,
Yes.
followed by the pancreatic ulcerated type and diffuse infiltrated type.
Okay. Among this Borman's classification that you are telling me, what is Linitis plastica?
Lanitis plastica is the diffuse infiltrated group.
Yes. And how does it appear?
Yes. So I will can do the question again.
Okay.
Yeah, sorry.
Right. You can come back to that later. All right.
Yeah.
Can you please tell me what is the pathogenesis behind gastric carcinoma?
So according to chronic gastritis, the normal gastric mucosa go into the intestinal metaplasia, which later which began the dysplasia, leading to the intramural carcinoma, and then began the invasive gastric carcinoma.
All right. What happens then?
And then they spread to the other organ by the metastasis by hemogeneous or lymphatic or transluminous spread.
All right. Okay. Can you name few risk factors which contribute to the formation of gastric carcinoma?
Yes, the risk factors are the H. pylori infection, smoking, H. pylori smoking in chronic atrophic gastritis, interstitial metaplasia, pernicious anemia, and previous gastric surgery,
Yes.
and adenomatous polyp, whose size is greater than 2 centimeters.
Greater than. All right. Good. And maybe blood group A, diabetes mellitus, male gender, etc. All right. Can you please tell me what is the most common histological type which is present in gastric carcinoma?
Yeah,
Histology.
adenocarcinoma present in the 90% of the cases.
Yes. Yes.
This is a common type.
W- It's divided into what are the different types of adenocarcinoma you can tell me?
Different types of adenocarcinoma.
Yes. Intestinal and diffuse. Which one would be which, if you can tell me?
In the center, this is a well differentiated type, and the few types are the poorly differentiated.
Yes.
In the center types are closely and it's typically found in the men and more common in the older people. The few types are grow aggressively and common with the metastasis and common in the younger age.
All right. Can you name few others types which has been also identified?
Okay. The other types are the hereditary diffuse gastric cancer, melanoma, carcinoma, lymphoma,
Yeah.
gastrointestinal tumor,
Okay.
and carcinoma syndrome.
Can you tell me how does the gastric carcinoma metastasizes or spreads?
Gastric carcinoma also metastasized by the hematogenous spread,
Okay.
transluminous spread, lymphatic spread.
All right. All right. When it spreads through hematogenous way, what are the complications or what are the outcomes that you can, by which you can guess that this is gastric carcinoma?
There will be the
When it causes obstructive jaundice, then,
also the SID.
all right. Any other complication that you can, virtuous node and what sign? I'm telling you, but you should be telling me. What
Yeah.
happens when it reaches the ovaries? If it's a female,
Oh,
this is male
yeah, it's
patient.
a transluminous called the
Yes.
cucumber tumor or the ovary.
Okay.
Yeah.
Right. Can you tell me how would you confirm your diagnosis that this is gastric carcinoma? What investigations can be done?
First of all, I would like to do the full clinical history data clinical examination
Yes.
and do the full basic investigation, full blood count,
Yes.
blood grouping matching, UND creatinine, electrolyte, liver function. I would like to do the sun tumor marker like the CEA, CA99, and I would I would like to do the gaso iso gaso esophageal gastroenterology for the diagnosis and tissue diagnosis, and for CD abdominal and pelvic for the tumor staging.
And anything else? Okay.
Is there the SID? I would like to do the abdominal SID test and send for the fluid cytology.
All right. Okay. Considering this patient, what management or treatment would you suggest?
The patient also undergone the gastrectomy and splenotomy. He need to do the same vaccination against the encapsulated polycyclic organelle, the Neisseria meningitis, the streptococcal pneumonia, and also need a prophylactic antibiotic.
Okay.
For the gastrectomy, he may also need the chemotherapy, or if there's a signs of recurrence, he may need another surgery.
What are one complication that you should be mentally prepared for after the surgical procedure or resection that you have offered to this patient?
The one complication for the early complication, there may be the anastomosis leakage,
Yes.
infection hemorrhage.
All right. Come to the, yes, come to the
Late
most
complication.
demanding. Yes.
Yeah, late complication is a Dumpling syndrome.
Dumping syndrome. Yes.
Dumpling syndrome. Sorry.
What do you know about the dumping syndrome?
Dumpling syndrome is occurred due to the loss of the reservoir function of the stomach after the gastrectomy, result in the rapid transit of the highly osmolality substance into the duodenum after the meal.
All right. There are two types of dumping syndrome.
Yeah.
Can you classify those, please? What are the differences in
There are two
early
kinds of
and yes?
Dumpling syndrome. The first one is the early Dumpling syndrome, which occur within the 30 to 60 minutes after the meal. If present with the signs and symptoms of the abdominal pain, diarrhea, and tachycardia and postural hypotension. And the second one, the late Dumpling syndrome, which occur 1 to 3 hours after the meal. It's also presented with the hypoglycemia, subsequent hypoglycemia.
All right, good. Can you help me and read this image, please? What are you looking at?
Yeah. Is a histological disorder.
Yes.
Which showing the different size of the different size and different architecture of the
Yes.
the nucleus is the nucleus are also by different size and different shape. So the multinucleated nucleus and the cells are the pleomorphic nucleus.
What is the shape of this cell that you're looking at?
And this is so I will come back to the question again. Sorry.
Okay. What is signet? What is literal meaning? Like in English, what is the meaning of signet?
Sorry.
Here is signet.
Thickness, yeah.
Ring-like.
Ring light. Oh yeah.
So these
Thickness.
are the typical
Ring
signet
light.
cell.
Oh,
So
ring light.
this
Yeah.
is typical of gastric carcinoma. So what exactly are you saying? Which dye? Can you comment on the dye? You discussed about the cell types and all right, you can tell me later. Thank you.
Thank you. Sorry, I will provide again.